You're listening to Up on Medicine with Jeff Levy, Bonnie Jane Bentley, and Dr. Ronald Belsic, right here on LA Talk Radio.
I think it's done.
Okay, we're ready. I think I might have played the music because it's up there. Oh, well. Is it playing?
I can hear it.
There, okay, that's my son Adam.
Nice.
Yeah, played for Nora Jones.
Wonderful. Great. Oh, wow.
Started when he was 13. And here we are. Welcome. The show is called Up on Medicine. I'm Jeff Levy. They call me the digital doctor, but I actually lecture doctors for their continuing medical education all about technology. That's fun for me. I'm here with my two best friends and partners, starting with
Bonnie Jane Bentley.
who is a caregiver, a consumerist, and a whole laundry list of good things.
Yeah.
Indeed.
Yeah, I've been a biofeedback therapist, a neurotherapist, and an
Executive
at
and
a big
oh yeah,
magazine. Yeah.
magazine, yeah, model, actress, all of that.
Okay.
She's blushing.
She's
Yeah,
blushing.
she is blushing.
Oh my! Our partner, Dr. Ronald Belsic.
Hello, this is Dr. Ronald Belzic. I'm a foot and ankle surgeon specializing in amputation prevention at Sherman Oaks Hospital.
A member of,
The Prime Healthcare family.
that's a big family. They've got tons of hospitals.
They do.
Yeah.
And we have a guest, which we'll introduce
No,
more later.
we
but
have
you
a
can say-
super guest.
We have a super guest.
Yeah, Dr. Melanie
Yes.
Ho Herb, who is an incredible surgeon. We're going to talk about eyelids. And
Yes,
other
we are
things.
going to talk about eyelids and,
And
other things.
maxillofacial and all that good stuff. So look, this is a kind of show where you're going to learn a lot of things about medicine, the doctors, the companies that build things, the inventors, all the new technology. We are your window on the world of medicine, and it's all in plain, easy to understand language. We don't get real technical. You can email us at uponmedicine@gmail.com. You can call us at 844-339-5333. It's a toll-free number. 844-339-5333. Jeff. Yeah, that's with Jeff. That's how I remember it. Exactly. And we also do a show following this called Turn On to Tech, which is a lovely show. So we're going to do a shout-out. We call it a shout-out. It's a mention.
Oh, who have you got?
A sore throat. You were paying $120-something a month
Oh, yeah.
for AT&T to get slow DSL and a landline. Mm-hmm. I don't want to say it was slow, but you could walk to the internet
And
faster than that.
expensive.
Yeah, so we hooked you up with a product called Broadband Fusion from our friends at DSL Extreme. Now you have 3 times the speed and a landline for $34.95 a month.
Can't beat that.
Can't beat
Such
that.
a
Saves me
deal.
$1,000 a year.
You saved. Yeah, and you got fast. We put seatbelts on
Oh,
your chair.
yeah. It
really good
shocked
stuff.
me the first time. He said, watch this, watch it come up. I went, whoa.
Boom. Yeah, you did. You
I don't have
just
to
kinda-
wait anymore.
No more waiting. DSLextreme.com, or you can call them at 866-2-GET-NET. Okay, we generally start before we have our guest with In the News.
In the news.
So we'll get to you very quickly, Doctor. Let's get to In the News.
Okay. Well, you know the game Operation? Did you
Oh,
doctors
yes, I
ever
loved
The
playing that
surgical
game.
You
That's
play
how
the
I,
game?
That's how I practice before my surgeries.
We are in deep doo-doo, people. Dr. B, are you doing that?
I'm trying to get the little ones into it right now.
Oh, but you do have the game at home then.
They have that
That's
ankle
fun.
bone, I believe.
Oh,
Oh,
gosh.
my God. Okay, so the game is called Operation.
Operation, and it's been out there for over 50 years now.
Wait a minute. We haven't had great computers for over 50 years, have we? That's interesting. Okay.
Okay. Although the game has made tens of millions of dollars for the manufacturer, the inventor only got a $500 check for the idea, and yet how many people have played that game and become doctors?
Yeah.
Yeah.
I can see why you're having your kids play at a young age.
Mm-hmm.
He's the Linda Lovelace of that industry.
What?
He didn't get very much money.
Oh.
What did you think I meant?
It was just a strange comment. But I can expect that from you, Jeff. Okay.
Probably not.
Okay, here's something you have to be concerned about during the holidays. Cooked rice is an enemy at the buffet because it can make you sick.
Really?
Yeah. It's called fried rice syndrome. But letting cooked rice sit on the counter is safe, right?
No.
There's no protein. So shouldn't it be safe? Well, there's Bacillus cereus, and it's serious stuff. It's spelled Cereus, though. And it's heat-resistant spores of bacteria that can germinate at room temperature. And, you know, how many of us have cooked rice and left it sitting on the stove or
I
the
do.
counter thinking, oh, well, there's no protein in it. Right. Okay. So 1 to 5 hours after eating, you can have nausea and vomiting, and it's not very fun. So you've got to cool it down quickly. Don't leave it out.
Okay.
All right, the other thing, metabolism boosters. If you drink 17 ounces of water in the morning, it boosts your metabolism by 30%.
Drink that
Wow.
water.
Okay.
Yeah, you want to drink
We are
that
gonna
water.
drink lots
Oh,
of
yeah.
water.
Yeah. So eating eggs and other lean protein for breakfast spikes your metabolism also. And if you add hot sauce or salsa to it, your calorie burning just goes way up and you eat less later in the day. It helps your appetite.
I love it. That's good.
Oh, yes. Then, I have a gift idea for the holidays, which is different. It's the International Animal Rescue Organization. .org. Yeah, okay. And for $78, you can give a gift to support an orangutan baby or a sloth baby or any different other types of animals that they save. And so they need nursing and taking care of. And so you get progress reports sent to you, and you can log in to keep track of your adopted baby. So it's a great gift for a kid, especially if they want a puppy and you don't want to get them one.
Yep. A lot less walking.
Yes.
Yeah, yeah.
So now you have a question.
Oh, yeah. So don't answer, though.
No, but I'm going to say, Dr. B, this would be good for your children. Thank
What's
you,
the
Doc.
longest bone in a lemur?
It's probably the same as a human. It's probably the femur.
The lemur
It's
femur.
a lemur
Yeah, you
femur.
got it.
But what was
Yay.
really funny is on one of the news shows,
That's
the
funny.
news person was going to do this and say, "What's the longest bone in a lemur?" Instead, he said, "What's the longest femur?" Oh! I did it wrong.
Gave it away. Well, it's a good segment in the news, and I think we should get right to.
I think so. Get
Dr.
right to
Erb.
our
Why don't we
guest.
share the intro?
Okay, hold
Dr.
on, I have to get
Melanie
back
Ho Erb, ERB,
That's correct.
MD extraordinaire. You are board certified in ophthalmology, and you are fellowship trained and certified in occufacial plastic surgery. The very specialized area of plastic surgery focuses around the eyes and the face.
That's correct.
You were born in Los Gatos near San Francisco.
A California girl.
Oh, yeah. Can't you tell by the tan?
Can you tell by the accent?
Yes,
All right.
absolutely. Go ahead, Bonnie. We'll alternate.
Okay. All right. She earned her BA from UCLA and then went on to UC Irvine to get her MD and was at the top 4% of her class, winning the prestigious AOA award, which I don't know what that is, but it must be pretty
That
find
stands
out.
for Alpha Omega Alpha.
Ooh, okay. Okay. And the surgery internship at UC Irvine as well, with subspecialties in plastic surgery. Can you tell me what
Otolaryngology.
Otolaryngology?
Eye, ear, nose, and
That's
throat.
ear, nose, and throat / head and neck surgery.
Who makes these names up?
Neurosurgeon.
Well, I like how there's 3 different names basically for ENT, but ENT is the
Otolaryngology.
easiest way to say it.
Okay. Then neurosurgery. Oh my gosh. Surgical oncology. And after that, her ophthalmology residency at UC Irvine, where she won awards for outstanding eye research. And she's on the clinical faculty of UC Irvine now.
Or USC now,
USC.
actually.
Oh, I've got the
It's
wrong
USC.
notes here. I should be using these.
And she taught
It's the new
supervised-
USC Eye Institute.
There you
Oh,
go.
okay.
Yes.
And she taught and supervised ophthalmology residents at both UC Irvine and USC.
Yes, that's correct.
Wow. Go ahead, Jeff.
She had a 2-year. You had a 2-year fellowship at oculoplastic surgery.
That's right.
At iStetica, one of the few prestigious ASOPRS approved oculoplastic surgery training programs in the country. What do those letters stand for?
That stands for actually people call it ASOPers, so it's an
A
easy
bunch
way to
of
remember.
ASOPers, eh?
ASOPers, eh? And that stands for the American Society of Ophthalmic, Plastic, and Reconstructive Surgeons.
Wow. Wow.
It's a mouthful.
You have performed thousands of eye surgeries, cosmetic, all kinds of procedures. What kind, Bonnie?
Oh, well, we'll leave that for later when we're in the questions.
Oh, okay.
But she's a full member of like she said, the American Society of Ophthalmologists.
The ASOPers.
The ASOPers.
Whatever. I'm not
Yes,
saying
because
it.
it is a mouthful. We all call it ASOPers. You don't even try to use.
So they
trains
train
about
only about 20 surgeons a
per
year.
year.
Yes,
in
it's
cos-
very
one of them.
selective. Yes.
Oh, wow. In cosmetic and reconstructive eyelid and facial surgery. And you did a 2-year fellowship there. And then, gosh, only around the world there are approximately 500 such members who have passed their
Certification.
qualifications.
Yes.
And you're
Oh my
one of them.
gosh.
I am one of them.
Wow.
Yes.
Wow.
Well, why
What-
don't we
well,
get
you ask her to
started?
tell about herself. She would feel like she was like blowing her own horn. I'm glad we
Yes,
did it.
yes. Horn blowing is not a bad thing necessarily. You know?
Not when you've got that kind of horn to blow.
No, it's just, yeah. So why don't we start?
Okay.
The fellowship. What is a fellowship? I've heard Dr. Belzig, you've talked about that many times. What's a fellowship?
Well, a fellowship is something that comes after a residency. So when you become a medical doctor, you're required to do go to medical school. And then you're required to do a 1-year minimum of an internship. And when you do that, you're a medical doctor. But in places that are more city-like, where it has bigger population, instead of just doing an internship, people tend to do what we call residencies. And those residencies are in many of the different specialties. And then when you're done with a residency, if you want additional subspecialty training, you do a fellowship after that. So.
Wow.
It's makes you more and more specialized and more of an expert as you go along.
How did you get into eyelids? I mean, how does one decide? Because I've asked Dr. Belzig, how did you get into legs, feet, and ankle? But he's got a thing for that.
Yes. Well, actually, the reason I went into eyelids is because my patients don't die on me. So usually
And
it's
they don't lose body parts.
and
eh,
they don't
Doc?
lose body parts. That's right. So it's usually a pretty happy specialty. People are in there who are relatively healthy, or if they're sick, it's going to be something that is going to be just mildly affecting their eyes or eyelids. So, people are happy, people feel good afterwards, and people don't die on you.
Bonnie?
That's important. Yeah. Okay. So what are the common eye procedures that you do? What are the things that people most ask for?
Well, I'm an oculoplastic specialist, which means I'm an eyelid specialist. This means I do eyelid surgery every day, day in and day out. Along with that, I also do surgery of the areas around the eyelids. So in terms of the types of surgeries, eyelid surgery would be the number one. And that would be either cosmetic, meaning to make you look better, or functional, which would be either to make you see better or to protect the surface of the eye. So that would be the first one. Also, I specialize in lacrimal surgery, and the lacrimal area is the area where you have tearing. So I do surgery to help people with their tearing problems. And the last thing I do is, or the third thing I do is orbital surgery. And the orbit is sort of the bones around the eyelid. And so I work on the bones around the eye and the soft tissue inside of the bones around the eye. And then lastly is anything related to cosmetic surgery around the eyelids and face. So things like, brow lifts, Botox, fillers, and that sort of thing.
I
So
noticed
you're like an
smiling,
artist.
Bonnie,
try to
you're
be an artist.
smiling.
Yes, because she's like an artist. She
Can you
gets to make
imagine-
people beautiful.
Can you imagine Dr. Erb and Dr. Belzig operating on the same patient at the same time? One at the head, one at the feet.
Yes, we could do that at the
You
same
actually
time.
could.
Actually, yes.
Take advantage of the anesthetic.
Yeah.
So when you were talking about having people see better, you were talking about a condition called,
Bedroom eyes?
bedroom
Doctor,
eyes.
what
And
is
I thought
bedroom
that was
eyes?
looking at somebody in a sexy
That's
way.
what it's not?
Well,
What do you mean?
it is when you do it, Jeff.
Oh, thank you. You can come back for another segment.
Oh,
I
thank
like
you.
that.
Thank you.
What is bedroom eyes?
Well, bedroom eyes are when people have a slight droop of their eyelid that makes their eyes look a little bit kind of like they're closed a little bit, and it kind of gives this sort of sultry come hither appearance. Now, when
I
people
like her already.
now
But
what's
it can interfere with your sight.
That's
can't
right,
it?
it can.
Because and push down on your eyelashes.
Yes,
Yeah.
it can.
Not eyebrow.
Basically, whenever you have any drooping of the upper eyelid, if it starts blocking your sight, and you can tell that because it actually starts blocking the black center part of your eye called the pupil. If it blocks that
wonder.
area, then insurance will generally cover it for any repair.
My dad had it done in his 80s.
Exactly.
Yeah.
We do lots of patients in their 80s, 90s, and beyond. But the other thing that's interesting about bedroom eyes is when you're talking about the droopiness of an eyelid, the droopiness of your eyelid can occur from the muscle on the back side of your eyelid, which is the muscle that opens up your eyelid, or it can occur from the muscle on the front side of the eyelid, which is the muscle that closes the eyelid, or both. And that's why it takes someone who is an expert, because they can evaluate whether your problem is from the back side of the eyelid or from the front side of the eyelid or both, and they require two different types of surgeries. So as an example, a bedroom eye would be because of the muscle on the back side of the eyelid. The one that opens the eye isn't quite
It's not just
pulling
removing
up.
some skin.
Exactly.
It's like with me, I have to
Gotcha.
raise my eyebrows to get my eyes open.
Yes,
We're
exactly.
going to do that surgery after the first of the year.
Okay.
And then the
You
other
are,
half,
I'm not.
No, that's true.
I'll be there for you.
She and I are. Oh, thank you.
there you go, and be rooting for him. And the other problem is if you have a droopiness from the muscle on the front side of the eyelid, well, then that kind of muscle and skin kind of hangs over the edges of the eyelid and eyelashes. And that isn't so much of a bedroom eye. That's more like, bags and skin, and that's hanging
that happens
over.
under the eyes too.
On the underside of the eyelid, it's the muscle that opens the eye. And so there's two different types of surgeries, and sometimes one person needs one or the other or both in order to get the full correction that they need.
So once you put the protection inside the eye cup in there, you just get at it, huh?
That's right, exactly.
Eye cup?
Well, something to protect the eye itself. Yeah.
Yes.
I don't want to know.
Yes,
I just want to
exactly.
go out and wake up.
Well, you want to
That's
be
right.
with somebody who knows what they're doing.
I think we are.
Yeah, someone who really knows what they're doing, like this lady.
Well, I think next week Dr. Belzik will do a report on bedroom feet. What do you think, Doc?
I'll look it up, or maybe actually a new term.
Well,
Actually, that would probably be a warm foot instead of those cold feet that people stick against your leg,
there you
when you're
go.
trying to sleep.
I
That's
like
definitely
that.
the non-bedroom feet,
yeah,
the
the
cold
non-bedroom
foot
feet.
when they
Sure.
when they reach over and touch your leg with it.
So where are some of the places that you work? You work at a lot of places.
I do work at a lot of places. As a subspecialist, you have to remember that we have to have a large population to serve in order for people to come see me. And instead of having people drive all over the city to come see me, I'll go to different places around the city so they don't have quite so far to drive. So the different locations I work at is in my own private practice, which is Aesthetica. We have multiple offices. Actually, our group has 4 oculoplastic specialists, and we cover at least 7 different locations. But my own personal locations are in Pasadena, and in downtown Los Angeles, and in Torrance, so that people don't have to quite drive so far. And then also I practice out of the San Fernando Valley at Valley Eye Center.
Valley Eye Center, Dr.
Yes.
Ryasich. Remember him? He was a guest on our
Yes,
show.
exactly. In order to service the patients over there as well.
So you did your fellowship at Aesthetica, and now you work there.
That's correct. I'm the
Nice.
first fellow that they took on as to stay on and be like a staff attending physician and partner after finishing my fellowship.
Well,
I have another question
my
about
research
eyes
staff
before-
tells me that you did some amazing eye research.
Okay, we haven't talked about the bags and the things underneath the eyes, and people that just want general, a little lift.
Lift.
Yeah. What do you go about doing? I mean, there's fat in there, and
Well, in terms of lower eye, so upper eyelid surgery when it looks like it's drooping can be addressed with surgery, and then also lower eyelid surgery when it seems like you have bags under the lower eyelids, or puffiness, or excess skin, just looking tired. That can be addressed with eyelid surgery as well, which is called a lower lid blepharoplasty. Now, lower lid blepharoplasty can be performed in many different ways, and it's a very complex area. So you have to do a full evaluation to evaluate the amount of fat.
Well, what if somebody has
amount of
circles
skin.
or circles or puffiness? Puffiness, you have to remove some of the fat or skin, or can you use lasers?
You can. So you generally would remove the fat you can remove it with many different techniques. Lasers can be used, cautery can be used. But the other thing now, too, is people are looking at volume and thinking that volume looks youthful. So what you have to do is evaluate the fat, but you have to evaluate the bony tissue underneath and really decide if someone actually needs filler under the eyes to make it look more full and youthful, if that's the problem, yes, exactly, like Juvederm or Belotero, or if they need fat removal, or what we also do is called fat repositioning, where we take the fat where it's puffing out in the area and set it kind of back in
Can
and
you take
deeper.
it from elsewhere in the body?
Yes, you actually can take it from elsewhere in the body, and try to get all of those abnormal contours more smooth.
Okay.
So, for each patient, they have to be evaluated for their individual anatomy, their ethnicity, what their actual problem is, and what the patient's goals are. And they have to be custom tailored to each patient in order to get the results that they want.
Interesting. I'm ready.
I was going to say Bonnie would be a perfect canvas.
There you go, exactly.
So your websites, Doctor.
Yes, my websites I have, you can find out more information about the types of surgeries I do, and also you can see before and after photos of patients if you're interested, along with getting more information about some of the conditions involved. And my websites are www.drherb, and that's ERB.com. You can also find it out on our company website, which is www.Eyesthetica, and it's difficult to spell. It's EYESTHETICA.com. And that gives more information about the whole general practice as well.
Outstanding. Thank you very much for joining us.
Oh, you're welcome. My pleasure. And thank you very much for having me. I appreciate it.
Well, you're a great guest, and I'm going to have the surgery in a month or so.
Yes, yes,
and,
yes.
I will be black and blue bruised for a week or two. So
No, not if you take arnica first.
Whom?
Not if you take arnica first.
There you go, Doc.
There you
Do
go.
you give your patients arnica?
Yes, he will be taking arnica, but still, we're going to do a lot of work, so it may be black and blue for 2 weeks,
It'll
so
help.
we'll see.
Well, Doc, we appreciate your time. We know you're busy. If you have to leave, we understand. If you want to hang with us and comment, we're more than welcome.
Okay, well, thank you very much. I appreciate the
Meantime,
time.
in 2 weeks when you do him, he's going to say he's going to tell everybody I beat him up.
You got to go
all
for
the fun
you
out
got to
of
go
it.
for all the sympathy points you can get.
Yeah.
Absolutely.
Yeah. Okay, so let's continue.
Okay.
There's a new study involving electrostimulation for spinal cord injuries. Remember Christopher Reeve? Mm-hmm. He was a wonderful actor. He played Superman. He fell off a horse and was paralyzed. He spent a lot of money in this field doing the research. And so people who have had the injury often not only can't move their limbs, but they lose bladder control, which is no fun at all. And so this electric stimulation allowed 4 patients to actually voluntarily stand up. Stand up.
Wow.
And move around a little bit. They weren't doing the boogaloo, but they actually could move around. And in experiments with rats, they were able to stimulate bladder control in rats that had spinal cord injuries. That's rather amazing.
That is amazing.
It got very
That is
quiet in
amazing.
here all of a sudden.
Yeah, well, I'm fascinated. I'm fascinated
Yeah.
because there's a lot of people out there also with bladder problems.
Yeah, it's an amazing thing. Speaking of amazing, we're going to be talking to Dr. Jacobs, who's going to be calling in. This device is actually a lancet used for bringing blood for your glucometer to test. And that's no fun because you stick your fingers, your lower abdomen, your thighs, and it's a little pinprick, but nobody looks forward to that. Well, some people do. This
make you
thing,
cringe and go, oh,
yeah,
doctor, do it again.
this
Yeah.
thing, and I'm going to ask Dr. Erba about it in a minute before Dr. Jacob calls in. It vibrates the skin, and get this, the needle plunges in and removes itself in 18 1,000ths of a second.
That's amazing.
Why does vibrating the skin help ease the pain?
Well, when you give
Should ask
shots
Dr.
of
Jacobs, but I wanna
local
hear-
anesthetic, you'll see often physicians will vibrate the skin or dentists will vibrate the skin, and it kind of confuses your pain sensors, so you don't really feel the pain so much. So that is an ingenious invention to really reduce pain on the injection site. It sounds like a really great invention.
It is, and we've got something more that's amazing. Dr. Belzik, you want to talk about median nerve implants? Median nerve implants. How about that? In the arms?
Sure. So the median nerve is one of the main nerves of the brachial plexus,
Which is?
and so it starts from right below the armpit to the arm.
Ah,
And at the arm, it's purely sensory, and below the elbow becomes a motor nerve. But this particular study is how an implant potentially can combat hypertension. So, can you hear me?
No, no, no. I'm just telling him to, when he speaks in, to speak into the mic. He hasn't been doing that. Sorry, doctor.
can't take me anywhere. I'm going
Sorry,
to put the
Doc.
You can
headphones
get him
on in case
dressed,
the
but
guest
you
calls
can't take
in.
him out.
Go
So-
ahead, Doc.
It's very interesting because actually I'm not familiar with this, but many times they'll use electrical stimulation, low voltage for pain. And here they're using implants for hypertension. So
Like,
Wow.
like high blood pressure.
high blood pressure. So this is very interesting. It's something that's novel. Drug-resistant hypertension can be a killer, and it makes life very difficult for sufferers. They'll use acupuncture to help reduce blood pressure in many patients. And so this is a similar use of technology by Valencia Technologies in Valencia, California.
That's local.
Yeah.
And they rely
Magic
on
Mountain.
they rely on tiny implants near the median nerves in the forearm.
The only
Wow.
thing is, Doc,
So you got to go to Magic Mountain first,
Yeah.
and then afterwards get the implant placed.
well,
and
the
then
problem I have is if I'm trying to lower my blood pressure and my doctor says we're going to put you to sleep, cut your arms open, and stick something in them, and then I'm going to expect my blood pressure to go down.
well, it'll be up just before the surgery, but it'll
Yeah.
be down after the surgery.
there you go. What do you think, Doc?
I don't know. I mean, I think it's very novel. I'm not familiar with, this particular nerve affecting hypertension, but maybe if people are reacting to pain from, let's say, for instance, a carpal tunnel, for instance, and it's causing their blood pressure to go up, maybe there's something to this. But the implants are the size of a small coin, and it's used to deliver a low power electrical current to stimulate the median nerve.
Bingo.
Yeah, I would think that it's a lot healthier than taking medications over a long period of time if it works for you. I
As
mean,
long as the
you
battery
know.
doesn't leak.
Oh, Jeff.
No, that's important.
That's true. I mean, I wouldn't have thought of that.
Doc, maybe someday they'll have that kind of implant to help with peripheral neuropathy.
They are currently working on something.
Wow. Bonnie, you want to get into Stop Saying? I know our guests will be calling, but I think we have time.
Well, did you want to finish the thing on Christopher Reeve?
Oh, yeah.
Or the one
I
about...
think we're done.
We are?
What did I leave out?
I don't know. I wasn't paying attention.
Oh, no, I think we got it. No, I think we got it. I think,
Okay.
yeah, let's do yours before he calls.
All right. I don't know if we have time because it's a 2-pager.
Go for it.
Okay, there are 35. Okay, there's a new book out called Stop Saying You're Fine. It's a caregiver's guide for help. There are 35 million caregivers in the United States. They care for the elderly, cancer patients, sick relatives or friends. And CNN contributor Mel Robbins wrote this book to help them. So they're part of that sandwich generation that still has kids at home, but they're trying to care for their elderly parents, and it's really stressful and overwhelming. So they usually women in their 40s, and half of those women are doing it totally alone. So it's tough. Dr. Oz was saying that guilt is a disguise for love. When you're thinking, oh, I have to do this for my mom or dad, or I have to do that, you're really saying is how much you love them. And you don't want to let them down. It's a frantic feeling because the time with them is running out. So it's important to spend quality time with your loved one and get someone else to clean the gutters. You know, if they're worried about the rain gutters, don't you clean them. You spend time with them. And, whoops, I skipped down the page. Okay, organize your caregiving skills like you would your children's schedule. You get it down on paper and get it out of your head and list everything that needs to be done for them, because you can look down that list and say the things you definitely cannot do, and then you're going to have to get other people to do those. Give some responsibility to somebody else. And don't feel guilty about the things you won't do. Just solicit help. Now, ask for help, because women have a problem asking for help because they are control freaks. They are. They want it done their way. They tell you how to load the dishwasher. So the reason that women do everything and take care of everyone is it ensures that they're loved. You know, it's like they're a big part of your life. So it's
Wow.
hard for them to let go of that.
Wow. You've been through it.
I have been
You're
through
going
it.
through
I
it.
am going through it.
I've been through it.
I cared
Yeah.
for my fiance who passed away from fighting pancreatic cancer after 3 years.
Oh,
And
wow.
I'm caring for my 92-year-old now. I don't know how old he is.
91 and a half.
There you go. We'll split the difference.
And he has bladder cancer, so it's been a tough time.
And you know, Bonnie, I can understand because I took care of my mom and my stepdad separately. So
Yeah.
you can't really know about it unless you've been there.
Oh yeah,
Nothing
and
like-
everybody's gonna be there.
Well, I'll tell you what, I got a call while we were online, and I'm wondering if it has to do with our guests. So if you would pick up the next segment, or maybe you'll have Dr. B do it, I'm going to do a no-no, and I'm actually going to look at my cell phone.
Oh, do it. Well, we can skip down to. Didn't we have one that Dr. B was going to do
Yeah,
down below a
well,
little bit?
yeah,
The bone
Doctor.
finder. Can you skip down a little bit, Doctor?
Oh, Dr.
Yeah, let's do this.
Herb, wait till you hear this one.
Ooh.
So in many other parts of the world, there's research being done into conditions such as arthritis. And in many of those countries, there's not enough radiologists to measure angles and look at joint surfaces. And it's very labor intensive to do this type of research. So the Bone Finder is a new software that automatically outlines bones and could potentially save thousands of hours by manual work by radiologists.
They have to do that manually?
They do right now.
They take an
and
x-ray and they kind of trace where the bone sockets and the bones are?
Even though
correct.
it's done on digital film, digital.
do.
They still have to do that.
and there's a lot of variation from one person to the next, and so this simplifies things. It outlines the bones from X-rays. They're using that information on various type of arthritis research, and it's already being used to identify arthritis of hips, knees, hands, and soon other parts of the body. It's been given out free to a number of research groups, and soon will be available in hospitals.
How would that impact on your practice?
Right now, probably not much unless it's for academic purposes. But I guess if you're trying to, in the future, use a custom-made implant, I don't know, from 3D imaging, this could be potentially a way to simplify measuring degrees of angulation, the joint surface that you need to reproduce.
All of that.
Exactly.
Wow. What do you think, Dr. Herb?
Sounds great. Sounds
You don't-
fascinating.
You wouldn't have you wouldn't be able to use that in your practice, would you?
No. For us, the bones around the face, the orbit, maxillofacial area, all those areas, we don't have to worry about angulation and joints.
All that. You have other concerns.
That's right.
Okay, we should be getting our guests momentarily, but in the meantime, Bonnie, what should we do next? Let's do.
Go ahead and do face speakers.
Yeah. Oh, yeah. Faith speakers sounds like it's really something for the audiophile. But when you have somebody who's hard of hearing or can't hear, first thing they do when they get home is what? Take off their shoes, loosen the tie, take off the sweater, turn on the TV, and you can hear it in the next county.
Oh yeah.
Yeah, and you know that.
My dad has
Yeah.
2 hearing aids and they're never adjusted right.
Well, this new technology uses special speakers that are phased, so literally they can point the sound to the one person who can hear it really loud and clear, and you're standing next to him or her and you hear it normally.
Whoa.
Wow.
How would that be?
How close do they have to be to you?
Within 30 feet? It's pretty interesting. It consists of loudspeakers that are accurately phase shifted, which means if you have two speakers, they both don't speak at precisely the same moment in time. They're kind of, one's kind of a little behind the other or ahead of the other. That's called a phase shift.
So it's like stretches out the sound or something?
Something. It creates a hotspot. And if you're in that hotspot, you can hear it loudly. But if I'm sitting next to Dr. Belzik and I'm the hotspot, he'll hear it normally.
So Dad's Easy
Right.
Chair gets a phase speaker.
Yeah, I think we're going to order a couple of them.
Yeah.
The array has been tested. It works. It's possible to be literally gain a 30% increase in intelligibility in your hearing.
Wow, that would help because
That
his
is a
television,
major
he
product.
can never understand what they're saying. I hear it okay. Do you understand them? No.
Okay. All right, let's go to our next. I'm still waiting for our guest.
But that's like they have those phase speakers for the high end.
For this audio.
Right, for the audio, if you want to make your whole theater, surround thing so that it.
Yeah, if you
you're
want the
shut down.
lead violinist to be at your dinner table.
Right,
in the symphony.
exactly. Exactly.
So we want to have Dr. Belzik do that nasal thing, or you want
Yeah,
to?
do you have that,
Do you have
Doctor?
that, Doc?
Yeah, let's do it.
Go ahead.
Prochlorazine.
Yeah, you can say it.
Yeah, prochlorperazine is a
Chlorperazine.
it's used for nausea and vomiting, but here they're using it for migraine headaches in the form of a nasal spray.
Wait a minute.
That sounds
Migraine headaches are a big deal. Millions of people suffer from that. And you're talking about a nasal spray to fix it?
It's it's one of the top.
You've had them.
And a lot of people take off work from it, so there's lots of work hours loss and productivity loss from
migraines.
migraines. Yeah.
What is a migraine as opposed to a regular headache?
So it can last for a longer period of time, 4 to 72 hours, and often it's accompanied by nausea or vomiting.
It's
Many
very
people have
nasty.
a sensitivity to light. And it's estimated about 100 million people experience migraines in the U.S. 37 of those are from migraine headaches. So researchers have developed a preservative-free device driven from prochlorperazine nasal spray. Right now it's compounded by compounding pharmacists. And what it is basically a dopamine receptor antagonist that's used for nausea, anti-nausea medication. But apparently it provides better pain relief than other non-steroidals like keto.
Hang on, doctor. We'll be right with you. Go ahead and finish.
Okay.
Hang on, Dr. Jacobs. We'll be right with you.
And
Sure.
so it's better than some other alternatives. And currently it's only available as a tablet form.
Nasal
which has
spray.
No. The prochlorperazine is only as a tablet. But if you want to get it, it has to be compounded by a pharmacist.
Pharmacist. There you go.
And,
For all the migraine headache sufferers who watch our show, you've learned something. Interesting. On the line with us is Dr. Christopher Jacobs. He's a PhD. He's got an amazing background in medical engineering, biomedical engineering. He's the chief research engineer for this incredible company that makes a device called Genteel, as in being soft and light touch. Dr. Diabetes, first of all, welcome to the show. You're on with Bonnie, Dr. Belzik, and our guest, Dr. Erb. You're in good company.
you.
You're in good company, Doc. So I'm a diabetic. I used to joke about it. Being a diabetic, I could be a sugar daddy, but it's not funny. Not funny at all. And testing blood levels up to 4 or 5 times a day by sticking yourself with a needle is not a thing you look forward to, especially for kids. Type 1 diabetics, young kids, 5, 6, 7 years old. How do you manage that? Well, these folks at Dr. Jacobs' place, the Genteel, have this new invention. I'm holding it in front of the camera as we speak. It's like the size of a marker, one of those markers that
magic
you write.
marker.
Magic marker. It's not normally what you would associate with a Lancet. Doctor, what does Genteel do, and why is it different from the old stick your finger, say ouch, and then sample the blood?
Well, there's two things, Jeff. One is you don't stick your fingers anymore. You can get blood from anywhere on your body. And we have places on the body other than the fingers that give exactly the same test results as fingers, and we can go over that in a second if you'd like.
Yes.
And the other is absolutely no pain. So For a person that's been sticking their fingers for a long time or newly diagnosed that doesn't really want to get into the habit of making their fingers numb and calloused, Genteel will allow them to get blood from anywhere on their body, forearm, stomach, anywhere that's convenient at the time. Now, one of my favorite places is just like 1 inch up from your knee. You just put the Genteel down on that place wherever you want, and you push the activation button, and everything else happens automatically. The reason I like the knee, but it will work anywhere, is that nature must have known when you were a kid you were going to be like an idiot and skin your knees and bang yourself up all the time. So nature put very few pain nerves in the knee area. But because it's a moving joint, there are a lot of blood capillaries there. So you have the two wonderful things if you have to draw blood. No pain nerves, but an adequate supply of blood. And that's one of the best areas to use Genteel in, particularly in the morning when you get up. But forearm, I guess you've been using it on your forearm, right?
Yes. Forearm and fingers. So I know that your technology uses vacuum and vibration. How does that translate into painless sticking, painless needle in your body part?
Okay. If you picture the surface of your body, the skin surface, below that is the blood capillary system, and very slightly below the blood capillary system are your pain nerves. Now, Genteel controls the depth of penetration to such extreme precision that we can have the lancet go just to the blood capillaries, but never so deeply as to go into the pain nerves. So that allows you to get blood without pain, except people say, yes, but that's such a shallow lance. How could you possibly get blood up through such a shallow lance? And the answer is, as you just mentioned, vacuum. Vacuum pulls, as any kid knows who's drank a milkshake up through a straw, vacuum will pull a liquid up.
Doctor, I never thought I'd say this to another man, but where have you been all my life? Oh, my gosh, what a great idea.
It's wonderful.
So it's much bigger than a standard lance. Why is that?
Well, in order to get vacuum, you have to have a moving piston inside a chamber. And as compact as it is, this is the size that's necessary in order to pull a vacuum over the lance site or over your test area. It's about the size, a little bit smaller than a magic marker, but we do provide you with a kit that holds all your supplies, and of course, Genteel fits wonderfully into the kit. So
I'm holding it up to the camera.
You're really
now.
no different than you were before.
Great.
Who should use this? Is it specific to the type of diabetes you have, type 1 or type 2?
No, it's specific to if you need a drop of test blood for whatever reason. In fact, a reasonable percentage of the sales of Genteel are to people on Coumadin who need blood thinners. So if you need a drop of test blood, particularly if you need it on a frequent and repetitive basis, then Genteel is the right device for you, particularly if you just don't like pain.
I think that's a lot of us.
A lot of people, yeah.
Doctor, on the surface of the device that goes against your skin, I have a clear plastic device, but the kit came with different colors. What are the different colors?
Okay, those are called contact tips, and they are a ring that go around the travel where the lance goes. And they are different thicknesses. They get in the way of the lance going into your body. So the thicker the contact tip that you and the person uses the contact tip that's appropriate for them. The thicker the contact tip, the less the penetration. And so what you do is we recommend when you get this, you start with the thickest contact tip, and except for very old people that have very thin skin, that's probably not going to get blood for you. You move down to the less thin, or in other words, slightly more aggressive contact tip, and you try again, and you just walk your way down. This process takes about 8 minutes, and you will determine. In your case, it was determined that the clear one was the optimum one for you. For other people, it may be the green one or the violet one. Each person is slightly different, but here's the wonderful thing. Once you've determined that right contact tip for you, you put all the rest away, and you don't have to use them.
All right, and doctor, what is redrawing blood?
Oh, redrawing is a new development, and I'm happy to say that this came about by a person that has already bought it, in other words, a customer. And redraw says that if you lance with the Genteel and you keep track of where you lanced, let's say on your forearm, you can go back and take the lance out of Genteel, and just with the suction alone, you can draw blood up exactly the same amount of blood as you did the first time all day long. So with Genteel, you could lance once in the morning, draw blood repetitively all day long.
Wow.
Wow, that
I'm
is
blown away with
incredible.
that. Ay, ay, ay.
Well, it's wonderful for a person that has to go from sticking themselves 5 to 7 times, 3 times a day, whatever their doctor tells them, to only having to lance once in the morning and then get the adequate test blood for the rest of the day. 1 lance versus 6, say.
Doctor,
Wow.
we're running close to the end of the segment. I want to make sure that we get in the price. The price is $129.
Yes, but I'm glad
Yes,
you
but?
brought that up. We are having a Black Saturday
I saw that.
special, Black Friday special, whatever the name is. If you go to the website, you can get it just for these for today and through Monday for $99. It's
a good
a
saving.
special
What a
thing.
bargain.
We're announcing it on your show. But it's real. You could get it for $99
Where do you
all
get
day
it?
long.
We got to get the website.
Yeah.
Is it sold other than by your website?
No.
Okay,
No.
so
And the reason is that we want to deal with our customers one-on-one. We don't want it from a drugstore that maybe doesn't care how your use of it. Every person that buys it deals directly with us and with our incredible customer service.
Do
We
you
have
need
the
a
best
prescription
customer
for that?
service ever.
do you need a prescription for it?
No.
That's
No, this
great.
Is,
so this would be a gift item.
in fact, what's that?
It's a
would
great,
be a great
gift
item.
Yeah.
Yeah.
Oh, yeah.
Oh, it is a wonderful. The reason is it lasts. It's a 5-year warranty. If 4 years and 11 months it goes bad, we'll replace it free. It's a 5-year warranty. Every time the person uses it, they will think of you. You're giving the
Wow.
gift of no pain.
Well, that is a gift.
Thank you.
And so,
you.
doctor, you have a money-back guarantee. And when I spoke with Anita, who has been a wonderful help to get this together for us, who represents you in PR, your website, mygenteel.com. I want to spell that, mygenteel.com. And Bonnie, you and I looked at this. If you go to mygenteel.com/instructions,
Yeah, go all the way to the bottom of that first page,
And you'll see it.
and it'll say the instruction video.
Doctor, this is a wonderful invention. You must be very proud.
I am very happy, especially when it's applied, well, for anybody that doesn't like pain, but when it's applied to children, particularly those with type 1, it makes the difference from mom having to chase them under a bed in order to stick them. And I think the biggest thing for moms that are maybe listening that have children that they have to test at night, I can promise you with Genteel you will not have to wake your child up to test
Oh,
their
that's-
fingers.
Do it
You
while
could
they're
just
sleeping.
Great.
Wow.
gently
That's a great
pull the
Wow.
covers back, test it on the shoulder. If their foot happens to be sticking out, you can test it on the foot. It means that child can sleep through the night
Wonderful.
without you having to wake them up.
Doctor, how do people contact you directly real quick because we're out of time?
Support@mygenteel.com.
Thank you so much for the invention. I'm using it now. I love it. I'd like to have you come back after maybe 30 or 45 days and we'll talk about the experience.
Very good. And if you will, give them the website again, mygentel.com.
Thank you so much,
Thank you
Doctor.
so
what a
much,
what a
Doctor.
neat interview.
Thank you.
And thank you for Jeff's unit. 'Cause he's happy.
All good. All good.
Very good.
We're out of time. I don't know where it goes. We want to say thanks to Sam at LA Talk Radio, Dr. Erb for being our guest, Dr. Belzik for being our partner doctor, and Bonnie for being the
Wow.
best friend ever.
Oh.
And a really good radio
And
friend.
I make good Thanksgiving turkey.
Oh, yeah, among other things. Thanks for joining us. Stay tuned for the Tech Show. We'll catch you later. Take care.
Good night.
Be good to yourself. Good night, everybody.
Bye.
You're listening to Up on Medicine
Good show.
with Jeff Levy, Bonnie Jane Bentley, and Dr. Ronald Belzik, right here on LA Talk Radio.